Welcome to episode 125. I'm Stuart McCullough. I'm the CEO of VHIA. And starting with this week's Industrial Roundup. For this week's Industrial Roundup, we're heading out to Kerrang and then to Horsham for the 29th and 30th regional forums of the past 3 years. We anticipate receiving the government-approved version of the employer log for nurses and midwives sometime this week. We'll be meeting with our reference group and with the Workplace Relations IR subcommittee of our board this week also to discuss that document. The Allied Health Professionals log of claims will be finalised on Tuesday with the reference group. There's an SDPPWG on Tuesday for medical scientists. The payroll reference group meets on Thursday, and on Friday some of us will be preparing for the grand final whilst others will be turning up for work and wondering why it's so quiet. As always, all of our activities are summarised through the VHIA Yemen network. That's it for this week's Industrial Roundup. It's now time for the weekly update.
Welcome to the weekly update, where we go in depth with a particular topic. My name is Emma Scott, Senior Workplace Relations Consultant at VHIA. Joining me today is Clinton Tomeldan, Workplace Relations Consultant. Welcome.
Thanks, I'm glad to be here.
Perfect. Well, you know how this goes, although you haven't been here that long. The mystery box. Would you like to reveal this week's clue?
Sure.
Okay, so for the benefit of people not watching, can you describe the clue that we've got there?
Well, Emma, that's my wristwatch, which I misplaced several weeks ago and could not find.
Yep, that is your watch. I may have taken it.
So you took my watch?
Yes. Really, it's to work out the purpose of the clue. Can you guess from your watch?
That you liked my watch?
Well, I mean, I stole it. I'm giving it back,
Okay.
but no, that's incorrect. So really what it is it's about time, and the time that we've spent working on the draft employer log of claims that was then distributed to members in September.
I see. Okay, that makes sense. Well, we have put a lot of time into it, but first things first. How was the employer log developed?
So it might be a benefit to put a timeline on the screen for members. What we did in the month of August, we had quite a busy month. We did meet with our reference group a couple of times.
Yes, we did. I think of most benefit was scheduling that 3-hour reference group meeting prior to drafting the first version of the employer log ready for distribution to various member groups on Monday, 2nd of September. Now that we've talked about August, what about September upcoming?
So also what we did in September is meet with the reference group again for consultation on the draft log that we did, but we also met with the HRIA groups in relation to metro and regional services.
Great, and then we sent the amended log of claims to CEOs?
Yeah, that's correct. So from the feedback that we've got to date, we did take that into account and talked with the reference group on the 11th of September, and we incorporated any changes that we thought were necessary as a result of those discussions.
Awesome, and we can't stress how important feedback is to what we included in our log. So what are the key dates on the screen going forward for our members?
So the most important one is really we've got a last reference group meeting on Tuesday the 24th of September to finalise the log of claims, and then also the 30th of September is when the final version is due to the government.
Great. Now, before we get into part 2, what are the key themes of the Allied Health Professionals log?
So for key themes for the Allied Health Professionals log, it's slightly different to the nurses agreement, and really it's about how there's various clauses within the enterprise agreement that don't really match health service practice, and really what they do is they impose a financial penalty that means service delivery can be compromised, and it really disincentivises positive workforce strategies and cooperation between employees and health services. So really we want to improve that framework through the work that we're doing on the employer log.
Great, and how many claims are in the employer log?
So there are 30 logs of claims altogether, and we've divided it into 5 parts. So the parts that we've got outlined on screen is Part 1, reducing complexity through industrial commonality. Part 2, reducing complexity by addressing inefficiencies. Part 3, workforce classifications and flexibility. Part 4, strategic changes to address key operational reforms. Part 5, best practice employment commitment. So members should note that Parts 4 and Part 5 are requirements of the state government wage policy, and really they mirror the nurses and midwives enterprise agreement claims. And then also in relation to Part 1, that is a similar thing. We're not going to go into too much detail about the podcast because obviously members have been briefed previously on those.
Okay, great. So I assume we can move through Parts 1 and 2 quite quickly then.
Yeah, that's correct. So in terms of Part 1, there are 4 claims, and that's about a consistent approach across agreements and that the matters should be consistent.
I assume those items regarding preference to an organization-wide approach?
Yeah, correct. So in terms of those clauses, it's really mostly in relation to procedural matters. And again, it's the same as what we did in the nurses and midwives agreement. So they do replicate.
Great. In Part 2, the title is reducing complexity by addressing inefficiencies. So what's the key theme for Part 2?
So for Part 2, it's really about making sure the agreement's fit for purpose and contemporary. And also our members and people that are dealing with it every day need to, clearly be able to interpret its contents.
Great. So part of the claim is to remove clauses that are no longer applicable, correct?
Yeah, that's correct. So what we've got outlined on screen are some terms that we've identified as likely to be made redundant for various reasons, and some might be that, well, really they're only applicable to some organisations, so they just shouldn't be in there. But yeah.
Interesting. So you also mentioned that the agreement must be, well, I think you alluded to the agreement must be written plainly and capable of being understood. So have we identified items that have been disputed?
Yeah, we definitely have, and there are actually a few that we've just outlined on screen to members.
So it's good to see that advertising of vacancies has made it on the list.
Yeah, so I think that's really one of the most important disputed items that we want to try and resolve. Yeah.
So why is it so important?
Really, because there's been lots of disputes between VHIA and members. What VHIA is trying to say is that the words immediately means that health services have to advertise positions within 2 days. And then they really also, believe that employers should exhaust the internal process for advertising before they go externally in all instances.
Yeah, that 2-day time frame seems unreasonable, and the 2-step process would result in delays, I think.
Yeah, that's correct. You're 100% right. So we think that it shouldn't work in that manner, and we should be trying to, decrease delays and make things happen quickly.
Are there other terms to note that have been disputed within Claim 6?
Yeah, I think there's the meal allowance where overtime is worked. So what we're trying to do is expressly exclude overtime and or recall when it's in advance. So for example, like a time frame of 3 days in advance, and also explicitly exclude telephone recall.
Great. I'm also aware that we're looking to reach agreement on Clause 36.3, which regards telephone allowance as well.
Yeah, so that's another one where we've had some local disputes occur. So really what we want to do is clarify that it's not an allowance, it's a reimbursement, because that's how the clause is termed, and also only reasonable expenses that are incurred with being on call are what you would reimburse.
Well, that makes sense. So as an example, where an employee uses their own mobile phone for on-call, and the employee cannot demonstrate that any additional cost has been expended by the employee as to what they already paid to maintain their own mobile phone, then no reimbursement would be payable.
Yeah, that's correct. There's no point.
Great. And what are some of the other claims in Part 2?
So what we've got in terms of what's most important is probably Claim 8 that we've got on the slide now.
And so what is Claim 8 about?
So really that's about amending or removing terms that are inefficient or historical anomalies that don't fit industrial principles, and redirecting them into more important things such as workforce strategies.
Well, that makes sense, given the cost of inefficient payment may be better directed to service delivery or a more contemporary priority.
Yeah, so the example is like change of shift and the exclusions. We want to make them bigger, the exclusions bigger so that the payments are reduced. Yeah.
Great. Anything else to note in Claim 8?
Well, I think, during the review process, we also did have some feedback about clauses 34 sole allowance and the 40 sleepover. So really we found that they weren't applicable, or they were quite, used of a limited nature. Yeah.
Speaking of surveys, I think one of our members also provided feedback regarding clause 42 and 43 during the review process.
Yeah, so clause 42 and 43 are about the travel payments and working away from home allowance. So when we negotiated the EBA, we didn't contemplate that people went on employer business overseas for, particular conferences and training. So that's kind of captured in the clause, which can result in excessive costs.
That brings us to part 3, which has 11 claims and covers workforce classifications and flexibility. Can you give us a bit of background on that, Emma?
So yeah, what we listed in the log of claims is just the different settings that allied health professionals work on. So really the background is making sure, that people are aware that the settings are varied and that the agreement takes into account, that they are, and that we want to support the growth of allied health professionals in the health service delivery.
Great, and I think that brings us to, one of the most important claims, which is Claim 11. Could you give us a bit of background on that as well?
Yeah, so Claim 11 is really about removing the restrictions for the fixed term employment clause. We've got a short summary showing on screen of what that means, but in terms of background, we did get some improvements in the fixed term clause, but it's still extremely restrictive.
Great, so as I understand it, the agreement currently restricts initial fixed term employment to 2 years and contains an exhaustive list of reasons a health service can use fixed term employment, correct?
Yeah, that's correct. So what we want to do is remove those restrictions and VARPA's right to veto anything that fits outside of those.
So there's also an automatic conversion from fixed term to ongoing employment in some circumstances as well.
Yeah, so what we want to do is we don't want to delete that because we know it's important for the government policy that we want to support full-time ongoing employment. So what we want to do is change it to a right to request conversion to ongoing employment.
So health services require more flexibility in the current clause, which is what we are seeking.
Yeah, that's correct. So we also have some other claims for flexibility in the workforce part of the log of claims, and that's in relation to 10 hours break after overtime and recall, choice of superannuation, and extending the circumstances where a roster can be altered to ensure the delivery of services.
Great, and I think I'm aware of also supervision and training of students, which I think is Claim 15. Do you mind maybe giving us a bit of background on that as well?
Yeah, so that's another issue over the life of the agreement that's come up, and really what we want to do is amend it so that grade 1s are able to assist in the training and supervision of students. The claim's really been made to make sure that we support the progression of people from grade 1 to grade 2. And that we've also found out that with the reference group that the university reimbursement rates hasn't really kept up to date with the labour increased cost of actually doing the supervision and playing that role.
Great. And I think Claim 16, which also regards the classification structure of allied health managers and assistant allied health managers?
Yes, the allied health managers and assistant allied health manager structure needs a review. There are some issues in terms of wage relativity where some of the senior clinicians at the grade 3 or grade 4 level actually get paid the same amount of money as the allied health directors or assistant allied health directors that they report to. So obviously that's an issue. And there are some old provisions that people refer to as the 2-up provision, which causes ambiguity, as well as, who do you count as direct reports to the allied health managers to work out their classification. So we want that reviewed.
Great, and I'm also aware that we have 4 more classification matters in the employer law. Do you mind maybe giving us background on that as well?
Yeah, so we've got Claim 17, which is the advanced practice. And really this is another structure that requires review. It was only reduced in the last round, and we've obviously through implementation had feedback from members about how difficult it is to implement. So what we've got identified on a slide is just some of the dot points that we've got for that review.
And also Claim 18?
So Claim 18 is in regards to additional classifications. So through the review process, again, there were some gaps that were identified where coverage might not be quite clear in terms of where these employees sit in the public sector agreements.
Great, and the classifications may be of interest to members. I believe there are the care coordinator roles that require an allied health professional entry point, which is a multidisciplinary role.
Yep.
Spiritual care workers, which are also referred to as pastoral carers, diversional therapists, and clinical coders.
Yeah, that's correct.
Great. And Claim 19, which I think addresses undertakings in the agreement, could you give us a bit of background on that as well?
Yeah, so when the agreement was approved, we obviously had to do some undertakings because we found that some of the wages for some of the classifications were below. So that's related to like your community development workers, your youth workers, your welfare workers, as well as there is a wage relativity issue, similar to what we've got with the allied health managers, with the Class 2 community development worker getting paid the same as the Class 3. So really we want to review it so we don't have to do any undertakings anymore.
Well, that makes sense. And the last classification claim is Claim 20, which is updating Schedules 1, 2, and 3 in Appendix 4.
Yeah, so that's correct. Really, that's about making sure the entry points of the different professions are updated and correct and contemporary, as well as making sure the examples of like the specialty areas are up to date, because obviously they change over time.
Great. And is there anything else maybe important to add?
Yes, so for the classification claims, what we have done is made them subject to funding, and that if there isn't any funding that they would be withdrawn, because we know that funding is a particular consideration for employers.
Great. Thank you again for that overview, Emma. And we hope that this was a useful briefing for our members, and we look forward to finalizing the log of claims through the consultation period.
Thanks.
VHIA.com.